dear companions. My name is Jean Fajadet. I'm working in Clinique Pasteur, Toulouse, France, as an interventional cardiologist. And today we have really the great pleasure to talk with our friend Flavio Ribichini, interventional cardiologist. He is the chief of cardiovascular division in the Verona University Hospital in Italy. As you know, the world is progressively hit by the COVID infection disease, and all the countries are not at the same stage, at the same level of infection. And that's the reason why we think that it's important to take the opinion and the recommendations from the people as Flavio. We have experience with the disease in order to talk about how to organize the cath lab in this period of disease. So I think it's very important to have the opinion today of Flavio. And my first question, and Flavio, will be, do we need to change our daily work modality? Do we need to change our daily work modality? In other words, do we need to stop routine practice? And how to be prepared to the big one?
Well, good morning, everybody. Thank you for sharing this opinion with the community. Jean, I think the pandemic so far has expressed very differently in different places at different moments. So it's very difficult to forecast its evolution in different parts of the planet. I cannot say on which extent you have to change your routine, but I do believe that it's better to get prepared.
And based on your experience to work in the in this red zone, which measures do you think that could be useful for those who are still not affected by the disease, by this aggressive attack of the COVID-19 pandemic?
Well, staying in the role of the cardiologist, because this is a complex decision that involves many professionals, but the cardiologist should focus on two main goals. One is helping to reduce the risk of spreading the disease by facilitating contagion, and the other is ensuring an adequate, safe, and effective cardiovascular care to those patients at risk of major events. The third goal, which is preserving the health of your team, your care providers themselves, without whom you cannot do anything.
And Flavio, at what point of the tide wave are you in Verona?
Well, this is a very dynamic situation, and Verona was hit by the expected peak of the storm last week. That was 2 weeks after we started having the first cases, and 1 week after we kept everybody at home. Everybody stays at home. There are no public services, no transportation, and this is already 10 days ago. At that time, when we got the peak, was very worrisome. We had nearly 30 to 40 hospital admissions per day, and a quarter of these patients needed intensive care. Now, since about 4 days, we have reached a plateau. That means 3 to 5, 6 patients, new cases per day, with 1 or 2 needing intensive care. Simultaneously, the good news is that we started discharging patients every day. During the whole period, however, we managed to keep our emergency system of cardiology up and running, so providing safe and effective care for acute coronary syndrome, ST elevation cases, and those who substantially may need a pacemaker implantation.
It seems that you have managed to obtain your 2 or 3 major objectives during this worst part of the storm.
Yes, so far it seems we are coping with the situation. However, we got from the medical direction this morning a warning based on a mathematical model of forecasting that warns about a second peak in 2 weeks by mid-April, and a third possible peak by the end of May. So it's very difficult to forecast.
So now my next question will be about the recommendations. Which are the recommendation that you would like, with your experience, to share with all the community?
Thank you for this opportunity, Jean. You know, experience might be very different. So what I say, it's valid in my hospital, in my city, in my region. I think we had the advantage of observing the development of the phenomenon in the nearby region of Lombardia. That means Milano, Bergamo, Brescia, Cremona, that was hit 2 or 3 weeks before us. So we had time to adopt timely protective measures. At the same way, this is, I think, the main goal of our talk today. Those who are waiting for the storm and now are listening to our interview will have time to prepare. In general, I'd focus on 2 different levels of preparation. One is general. One is based on the city and the hospital organization. People have to stay at home, and general hospitals in Verona have been divided in 2 halves. One which is dedicated to the treatment of infected people, and one which is clean of infection, where all the surgical facilities, included cardiology, are based. And the second point is the setting of the RNA determination of the virus, that in an intermediate area of isolation allows you to make a quick diagnosis in 4 to 5 hours and decide where the patient goes, to keep these 2 populations separate. Then under a cardiology point of view, well, we closed our outpatients clinic and we reduced the admission of elective cases. Certainly this helps to reduce the risk of dissemination and transmission of the disease. At the same point, we created a dedicated phone number for people having symptoms that might be related to the need of urgent admissions. We also divided the cardiology division in 2 different areas, one for patients that have no suspected symptoms and one for patients with suspected symptoms, in which they are isolated until we get the result of the swab. If the swab is positive, the patient is transferred to a COVID center. If the patient is negative, he follows the usual cardiovascular care. In this manner, as I said before, we still perform high-risk interventions in patients with symptomatic coronary artery disease. We still do structural procedures in very highly symptomatic patients. Of course, we keep our system of electrophysiology just for the implantation of pacemakers. And this has been done for the full month in a clean environment. And so far, we're very, very happy of this.
Thank you, Flavio. And, you know, when I was listening to you, I was thinking to an additional question. In other words, in Toulouse, for example, we have few cases. We have a lot of cases in France, in the east of France, the region Ile-de-France around Paris, and in Toulouse, in the what we call Occitania region, we are waiting. And so, do you think it is necessary to stop working and wait for the arrival of these next cases, new cases, where at present there are none or very few in our region?
It's a very important question, but it's a very difficult answer, Jean, because we don't know how the pandemic will transmit in different areas of the world, in Latin America or in Africa. But I think, no doubt, we should rather be prepared for nothing than being hit and not be prepared. You know, preparation before the arrival of the storm requires rather simple and costless maneuvers under a medical point of view. And this is basically changing our attitudes. The problem is the economic impact that stop working has in our societies. But we are doctors. I mean, we work with human lives. And for us, it's more important to preserve this. I think that a temporary economic imbalance will recover, but we will not resuscitate a dead person. I really hope that what has happened in Italy will not happen elsewhere. And I understand that in some places, like in Toulouse, you may feel like in the scene of En attendant Godot, these people waiting for something to happen and it's not arriving. By the other side of the spectrum, if you're not prepared, maybe the scene of Apocalypse Now, which is what is happening in some places in the world, and unfortunately very, very close to Verona also.
Could you summarize what are your three major advices for all the community?
Well, if I try to be simple, I'd say three different levels. First one is prevent. Prevent in a social, global understanding. Staying at home, washing hands, not sharing personal stuff in your family or with friends, and consulting the family doctor in case of suspected symptoms rather than going to the hospital. This is an act of massive prevention that anyone can do in any place of the world. Even in huge metropolis like in Buenos Aires or Mexico or Kenya. That is to protect your staff and to protect your patients. Protect your staff by training how to protect and using adequate personal protection instruments, and to protect your patients as far as you can to keep them separate if they are infected and if they are not infected. If the two populations mix, you lose control. And this has happened. I don't want to mention the places, but we are in contact with colleagues every minute, and we know hospitals that fall down in the evil of having a mix of patients with very high mortality rates. And the third one, which is obvious, is prioritize your actions. Do what is life-saving for your cardiac patients. And prioritize your doctors, your staff, cardiologists and nurses. Keep them healthy and available to give a hand in the global organization of your hospital. Infectious disease colleagues, they are leaving the hell. Pneumologists, they do need help. Most of them are sick already and are at home. And your intensive care colleagues, they are very busy. Cardiologists are good clinicians. They know about physiology. We are invasive in many things that might be useful. If you keep this population, we can give a hand in a hospital to cope with this problem.
Okay, thank you, Flavio. Very clear. Prevent, protect, prioritize. Thank you for these three advices. This was the first video of the series program to help you to face this COVID-19 pandemic.